We are here to address a crucial topic, breaking the stigma of mental health and how to foster open conversations. An extremely timely topic as well, given that May is Mental Health Awareness Month. But really, mental health and mental well-being should be a key pillar of our culture and be nurtured through proactive and open dialogue throughout the year. So we're thrilled to have Guy Westermeyer and Melissa Cotterill from Westcom as our esteemed panelists who will enlighten us on how we can harness the power of communication to prioritize mental health and foster a culture of resilience. Without further ado, our important conversation today about mental health. Let's keep the dialogue going and learn and grow together in the coming weeks. So let's get started. And over to you, Melissa and Guy.
Thank you, Sydney. We'll first do introductions. I'll let Melissa start.
Great. Good afternoon, everyone. Thank you so much for inviting us to be with you today. I'm Melissa Cotterill. I'm the Executive Vice President at Westcom. I've been in marketing communications for a little more than 25 years now, but only on the agency side for the last 7. I'm responsible for business development at Westcom, and I also work directly with a number of key clients, mostly focused on internal communications. So the majority of the clients that I work with are HR and employee benefits professionals and the communicators who support HR teams in large companies and organizations. I've also worked with a few employee benefit providers and insurance carriers on employee engagement programs and campaigns. Really happy to be here with you today and looking forward to this conversation.
Thanks, Melissa. And I'm Guy Westermeyer. I'm the president and founder of Westcom. Started the company back in 2001, and today we're about a 20-plus person team with offices both in Detroit and Indianapolis. And prior to starting Westcom, I worked at Ford, and then when Ford spun Visteon off, was part of the Visteon spinoff. So I'm going to go ahead and share my screen. Hopefully everybody can see that slide. Gary or Sydney, if you want to confirm that that's sharing, that'd be great.
Yes, you're all set.
All right, awesome. So before we dive in, I thought it might be helpful to have a little background as to why we're talking about this topic. One of Westcom's core focus areas is supporting communications and internal communication and HR teams on their communication efforts. We're frequently taking on assignments that help organizations communicate about their benefits and other HR priorities. And over the last 3+ years, this has evolved into also helping HR professionals begin to elevate that conversation around mental health in the workplace. We've worked on mental health campaigns across multiple industries, including higher education, manufacturing, professional services, and healthcare. And what we want to do today is walk you through, 1, why we believe this topic is so important to talk about, 2, the results of our mental health communication pulse survey that we launched in April. And then we'll also go through the 5 strategies that we believe you can use to help elevate the conversation in your own organization and help break the stigma around mental health. So let's get started. All right. So of course, with this statement that I have on the slide, it'll come as no surprise that we believe communication is a critical part of how we approach this topic in the workplace. Mental health in the workplace is an important issue, and it's not really a new revelation. For some time, many companies have been offering free counseling sessions for employees and their families through their employee assistance programs or their EAPs. What's new, though, is the more intentional effort that a lot of companies are undertaking to create a culture of support and well-being, one that breaks down the stigma around mental health so that employees can share more openly the struggles that they're facing without fear or concern. It seems natural for this to be on companies' radar. After all, employees spend much of their lives working, many times beyond their workday. And what's happening at work can bring stress home, and vice versa. The stress from home can come to the workplace. And communication is a critical part of how we approach mental well-being in the workplace. Proactive communications are going to be an integral part of making mental wellness and resiliency a key element of your overall health and wellness effort, and a normal part of your company's conversation and culture. What's great is We are seeing others in the HR community echo the same feelings. For May, we asked several of our clients if they would provide their thoughts on this topic, and we could share those via social media. And I won't read the quote to you, but Kate Fisher from Cummins is a passionate advocate for this topic and is working tirelessly to help equip the employees at Cummins. And, you can see that she also feels that this is a extremely important topic. And it's, while elevating that conversation and providing resources is the right thing to do, in our opinion, there's also business payoffs for organizations. According to the World Health Organization, for every dollar invested in mental health services, there's a $4 return on investment. We believe that prioritizing employees' mental health can directly and indirectly impact all areas of your business, including recruiting, retention, engagement, performance, and healthcare costs. However, just providing the service or benefit isn't enough. We have to communicate and make sure employees understand the benefit and resources available, and that they're comfortable accessing those benefits. So in April, I mentioned at the top that we launched a mental health communications pulse survey. And so I just want to walk through a few of the stats of that before we jump into the 5 strategies. So, maybe some of you on this call took the survey, and if you did, thank you for taking it. We had around 200 to 300 individuals take that survey. So this stat, 76%, is not shocking to us based on what we're all seeing and reading in our news feeds and why we're here today, right? So employees are stressed, they're facing mental health challenges, and that's why we're here. So the good news is that 82% of the respondents, so that's a high, obviously, majority of our respondents that completed the survey felt that their organization is prioritizing this. And to jump to another quote, as I mentioned, we asked several clients what their thoughts on this topic were. And Kathleen from Autism Alliance of Michigan noted that they're addressing this topic through benefit offerings and working to make sure that they are offering the benefits that help employees maintain the healthy work-life balance. However, this stat shows us that we have work to do. Roughly 50% of the respondents believe their employees understand what's available, and roughly 50% say they're regularly communicating. Again, I believe we mostly have communication professionals probably on this call, and we can all know that we have to communicate something many times to help our audience understand and begin to remember the message. And I would argue that when we're communicating about benefits and resources available, we probably have to even tougher time getting through the hearts and minds of employees because they're distracted with many other messages, right? And the last stat that I wanted to share, though, is that 75% of those responding say they rely on provider communications. And we do see a lot of organizations using the materials directly from the benefit providers. However, our concern is when that's the only communication employees get, an employee is more likely to ignore or not read that communication since it doesn't have your own company branding or messaging on it. It may be perceived as junk mail or spam if it comes into their email. And we're strong believers in using information from the providers, but layering in the tone, the brand, and the messaging of your organization. This helps tell your total story about what you're doing for your employees as well. And at this point in the conversation, I'd like to turn it over to Melissa, and she's going to walk through the 5 strategies that we think can help you break through the stigma of mental health.
Great. Thanks, Guy. What we are attempting to do with our clients is really to start a conversation with their employees. We believe that the more we talk about mental health, the more we educate employees on mental health related issues, and the more that we can direct employees to resources for help, the more productive those individuals will be, and the healthier and more productive their work environments will become. So we've put together a series of strategies that we've actually deployed with a number of our clients, and we'll walk through those, and then happy to take questions at the end if anybody wants to dive into any of the details on these. First up is demystifying the mental health benefits that are available to employees. So almost every company offers some type of mental health support to their employees. It could be through their health plan. programs associated with their insurance carriers or their in-network providers, local hospital networks. More and more of our clients are engaging in mental health counseling at their on-site clinics, and most often, as Guy mentioned, through employee assistance programs. EAPs are the most popular mental health services offered by employers. They are also one of the most underutilized benefit programs out there. So we want to change that. So our first recommendation is to take a full inventory of the resources that are available to your employees and then start to think about the best ways to promote those. So in typical internal communications, we are using a host of communication channels and tools for communicating about benefits information. And we tailor those depending on the needs and the makeup of the workforce. So we have lots of clients who have wired and non-wired employees, hybrid workforces, completely remote workforces. So we've adapted our communication styles to meet the needs of today's workforce. But when we start to dive into these resources that are available, we want those to be relatable. We want employees to be able to understand what the benefits are and how to access them. So we really try to break that down. One of the things that I was just working on this week for a client was putting together a list of examples of when an employee might use an EAP. And this was actually for a client that has a global workforce and working with a facility in India. And they wanted to focus on relationship issues that their people in their teams are having. So this could be marital issues, premarital concerns, parenting issues, interpersonal relationships and conflict at the workplace. So we put out a series of, here are all the examples of things that people are challenged by that EAP can offer you support and help on. And it's things that people may never think about. So that's just one example of how we try to show them how and when they can access this type of support. We also want to explain how the benefits work and what they can expect. So we have, with a number of clients, actually created some scenarios for employees to understand what's going to happen when you pick up the phone and call EAP or you schedule an online counseling session. What does that look like? How long do those sessions last? How many are you eligible to attend for free? What kind of issues do they talk about? And what kinds of services can you expect to receive support for? Really breaking those down. And then one of the things that we always try to reinforce when it comes to mental health services that are provided by the employer is the privacy and confidentiality of these services. That is the number one pushback that employers hear from employees about why they don't use them. They just don't necessarily trust that if the employer is paying for it, that information is private and confidential. And it certainly is, and it is protected information. The EAPs do not share that information with the companies. And certainly no one in the company would know if you were seeing a counselor or for what reason. So we really have to emphasize that because that is a issue in the minds of some employees. Guy already mentioned this a little bit, but we also preach consistency. This is not a message that you can throw out once and hope that it has some effect. This has to be an ongoing, persistent communication that is offered year-round, time and time again, talking about mental health in different ways and making sure that these resources are readily available and people understand what they are and how to access them. And then finally, we focus our communications on mental well-being, not mental illness. So we steer clear of a lot of the clinical diagnoses. We don't talk in clinical terms. We really focus in on the importance of taking care of yourself and how to be your best self at home and at work and in life in general. And we emphasize that everyone struggles with mental health challenges at one time or another. It doesn't mean you have a diagnosable disorder. It doesn't necessarily mean that you need medication or therapy. We all struggle and we all need support of different types. So we really try to focus on the positive as much as possible. For companies who want to go beyond just talking about the benefits and the resources that are available, we are seeing more and more companies embrace the idea of launching a full-blown mental health awareness campaign. We have several of these running right now with our clients, and all of them have a similar goal. First, they want to normalize mental health and break the stigma around it. It's great that they offer the services and resources for support, but if there is a stigma around mental health, people will not reach out and use those services. So before we can really expect to see an uptick in utilization of some of those programs, we have to do a lot of work to normalize mental health and try to break the stigma around it. The second goal is to educate employees about mental health in general. So teaching them about warning signs and symptoms, either in themselves or in others, helping them have conversations about mental health is a very tough topic. So we spent a lot of the communications and education around just talking about it. How do you broach the topic? And then empowering employees to help others who may need support, whether that's somebody in their family, a friend, or a colleague. We really want to empower people to be aware of these issues and to know how to respond when they're struggling or when others around them are struggling. So I'm going to show you just a couple of the campaigns that we are currently working on. Guy already mentioned Cummins. Cummins is a global manufacturing company. They have 60,000 employees across the globe, and they are passionate about mental health. I don't think I've ever seen a client as committed and as focused on a communications campaign as Cummins is on their mental health campaign. So the campaign is called It's Okay. They wanted to take a really positive approach and reassure employees that it is okay if they are feeling different emotions and feeling stressed and feeling anxiety. They want everybody to understand that that is part of the human experience and that we all face these types of challenges throughout our lives. And they wanted to embrace the idea that it is okay to have those feelings and that they care about their employees and they want to normalize these conversations. And most importantly, they want people to get the help that they need, and they will do anything they can to assist with that. So we have monthly communications going out across the globe in 24 different languages, digital, print, on-site. Again, they have wired, non-wired workers. We have language barriers. So everything we do is translated into multiple languages. And we really spend a lot of time thinking about how do we reach the people on the shop floor and the people all the way up to the C-suite with our materials. So we have done, I think, just about everything with this client. Video, events, print, digital, environmental signage, giveaways, tchotchkes, you name it. We've done a little bit of everything with this campaign. So they are finally, after 3 years, starting to really see some traction with this. They are starting to see a little bit of an uptick in the utilization of the services that they offer. And they're getting requests and participation from employees in this program in a way that is really exciting to see. Next is Purdue University. Purdue has recently launched this quarterly campaign where we are putting messaging out to their entire workforce on a quarterly basis that is really aimed at trying to get people to think about how to have conversations about mental health. So the theme, Go Beyond the Surface, we're focusing on how do you have conversations with people? How do you go beyond that just, hi, how are you today? And really start to listen for and be responsive to somebody who may be struggling. And what do you do with that? How do you respond? How do you guide them to assistance and help? And so this is I think we're in month, maybe this is the third or fourth quarter now for this campaign. So relatively new. But we have gotten a pretty good response on this so far. And then finally, this is an example of a theme that is being used by Ochsner Health. Ochsner is the largest hospital network in the state of Louisiana, and they are regularly publishing content related to mental health under this banner and theme of Mind Matters. So this is a graphic that is used on all these communications, and they're employing different ways of communicating about coping strategies, about the importance of sleep, the importance of self-care, nutrition and exercise, and how all of those things play into mental health. The other thing that we try to do once these campaigns are up and running, or even before they launch, we really think a lot about how we get managers on board with this. We have to do a little bit more education with managers than with just the workforce, because we want managers to be able to respond when their team members come to them, or they see a team member who they think may be struggling with something. We want them to know what to do, how to respond, and how to point employees to the right resources. So we spend a lot of time on talking points, educational events, slide decks, and activities that they can share with their teams. We're not trying to turn them into therapists. We always get a little pushback from managers. I don't want to be a counselor. And that's not the goal. The goal is just to prepare them and empower them to be able to respond and help their team members get the help that they might need. Managers are also really great to share stories and testimonials. So when we have a specific program that we're wanting to highlight, it's great when we have somebody in leadership who's willing to speak out on that and maybe share their own personal experience. So we use them in that way as well. Wellness programs. So many companies communicate about their wellness programs. Most of the programs are focused on physical health, but we encourage our clients to also incorporate the mental health message into the marketing of those wellness programs. So there are a lot of aspects of physical health that impact mental health as well. So when you think about things like sleep and nutrition and exercise, a lot of those things are incentivized in part of wellness programs. Talk about the mental health benefits of those things as well, and make that connection, because there is such a strong connection between physical and mental health, that this is one way that we feel like we can kind of double dip a little bit in the communication. We're really promoting the wellness program, but it's also offering us an opportunity to talk about mental health. And then finally, we've already mentioned that May is Mental Health Awareness Month. So we always encourage our clients to take advantage of times like this. October is World Mental Health Day. That's a big celebration for Cummins because they are a global company. So we really try to elevate what we're doing in those months and take advantage of some of the noise that's already out there about mental health in a positive way, and try to bring that into the workforce and use that as a springboard for additional messaging and education. So in the Pulse survey that Guy mentioned earlier, we had a number of respondents who had already said that they were hosting events, they were doing extra education, they were highlighting their resources, and using it as an opportunity to share stories. So I think I mentioned testimonials earlier when we were talking about leaders, but testimonials among any member of the workforce can be really powerful ways to reach employees. So again, I keep going back to Cummins because they're doing this so well, but they provide a testimonial every single month from an employee who shares very personal stories of their struggles. And it's just been amazing to see people come forward with their stories, be willing to share those, and then to see how people respond to those because they are so powerful. So a great way to continue that messaging is through employee testimonials. And then finally, everything that we've talked about is available to you if you want to download our mental health toolkit. It is available on our website free of charge. So a lot of what we've talked about today is recapped in that toolkit. So we would just invite you to take advantage of that and download it and hopefully put some of these ideas into place.
Great job, Melissa. Thank you for sharing that. And I'm going to stop sharing. Well, I'll leave this up for a little bit in case anybody needs that URL. But we do have a few questions coming in on the chat. So the first question was how are companies measuring success for these types of campaigns? I'll start a little bit of an answer, and I'm sure you have some thoughts there too, Melissa. One of the easy ways that we've had some clients measure the success is EAP utilization. I know Melissa just was talking about testimonials and the use of testimonials, and we had a client where a rather senior level individual shared their experience using the EAP in a mailer that we did to all their employees. And within the next quarter, they saw a drastic increase of people using the EAP. There's a couple reasons we believe that happened. One, you had somebody senior in the organization sharing their experience. Two, the person that was senior wasn't sharing that she was maybe, needed to be clinically diagnosed. It was that she was having some just family stress and, maybe I should call the EAP. And that's back to one of the first points that Melissa hit, that giving employees examples of how and when they might use the EAP that aren't the clinical terms or clinical diagnoses really does help people to go, I can get some help with this. My child's facing some stress at school and I need tips for how to help them. You have the EAP there for you. What are other thoughts you have on how some people are measuring success?
Yeah, sure. So a lot of things that we look at around the program include the interaction that we have on social. So we use with a number of clients internal social channels in measuring the engagement that's taking place with employees on those channels. We've seen an uptick there. Event attendance. A lot of these programs include quarterly. Some of them include monthly events. So we're watching the event attendance over time to see what kind of increase we can get there. Requests for information are being measured. So every time we have somebody who reaches out and requests additional information, everything that we're doing for Cummins is available online. We're actually building a website for them right now that will be open to anyone. And there are different metrics built into that website so we can tell what people are downloading, what information they're requesting, what questions they're asking. So we always have the availability for employees to ask questions and to share stories. So we're measuring that as well. And then finally, we're giving employees opportunities to volunteer. So we have mental health champions and voluntary training that's being made available through some of these campaigns. So we're seeing what kind of engagement we get there, and definitely seeing an increase in the number of employees who are stepping forward and volunteering to participate in one way or another.
Connie, thanks for that question. The next question is from B. I'm saying that right. And the question is the epidemic among kids with mental health issues impacts many working parents, and often in a sudden way. Yet the healthcare system and choices for pediatrics is stretched thin. What employer-organized approaches have you seen that link people together for mutual information and sharing and support? I'll start and then I'll toss it to Melissa again. Couldn't agree more. We again, a different client. We were they had a vendor summit and there was a whole bunch of vendors in the room. And one of the shocking stats that we heard in that meeting was that the number of employees that were seeking help or using the EAP and mental health services were actually higher. The spouses and children utilization was higher than the employee utilization. So great point, B, that, it is a really high utilization by spouses and parents, or kids rather. So making sure, I think on a communication standpoint, making sure that the employee knows that is an available resource for them, for not just themselves, but their spouse and their kid or kids is vitally important. But I'll let Melissa answer also, kind of how are we seeing employers try to, bridge that gap and kind of create some community?
Yeah, so very recent example, we just did in April a global webinar focused on children and mental health. And we had a couple of guest speakers participate. All employees were invited to attend. And we had a child psychologist who was on the panel and helped employees really think through some of the issues that are impacting kids. We made resources available to them in every country. We did some research about what beyond what the company was offering, what was available in the communities, support hotlines, other resources that might be available. And we published all of that information so that if parents were struggling with issues related to their kids, we made sure that they had some support and some help readily available. That webinar was attended by more than 1,500 people across the world. I think we had 15 different companies or countries represented. So certainly an issue that is playing out across the world.
And Shannon posted, have any of these organizations considered other tactics in addition to resources and training? For example, her organization is giving employees a mental health day during May that doesn't count towards the regular PTO. And do you want to?
Yeah, so we've seen that as well. That's a big perk that we're seeing more and more of. And we're really seeing employers look at their total benefits package and figure out what else they can do other than just the EAP, making wellness and mindfulness apps available to employees free of charge. I think Calm is one that you may have heard of. They have a business plan available so that employers can buy those subscriptions for their employees to use. So things like that, certainly starting to see an uptick in those extra added benefits that may not have been in place just a couple years ago even.
Another one that I ran across literally just last week and working with a client was they termed it, I can't remember the actual name of the organization, but they termed it chaplains, like on call, so to speak. But it was really that there's these chaplain resources that were in the facilities. And this was not a religious organization. So it was just they said, we have the EAP, but we also have this group of chaplains that if people need to talk to somebody, they can also go to them.
And I'll just add one more. We have a client who has guided meditation sessions available to employees. They last 30 minutes. They're on Mondays at 2 different times. They call them Mindful Mondays, and it's just a guided meditation exercise that people dial into Zoom and participate in. So we're starting to see a lot more of that kind of activity as well.
Any other questions that somebody wants to ask? There we go. Here's another. Sydney just asked one. What suggestions do you have to reach deskless employees in a manufacturing environment? I'm going to let Melissa take that one because she works on that almost daily, probably.
I was going to say my daily challenge is this issue. It is a challenge. Any of you who have worked in internal communications knows how hard this can be sometimes. So we are employing several different tools and channels across our global manufacturing client workforce. So signage is big, making materials printable and downloadable for managers to distribute, table tents, digital signage, and this website that is going to be made available, no login necessary. All of the information will be on a website. All of it can be auto-translated. Other materials can be downloaded that have already been translated and uploaded as PDFs so they can be easily printed and distributed. Text messaging is becoming more and more popular as well. We do a lot of home mailings. So that's a really popular way to reach not only the employee, but also spouse or partner as well. So we're big believers in home mailings. They are more expensive, but much more effective than sending an email and hoping that those non-wired employees will actually see it and do something with it.
Yeah,
and if anybody else has other ideas, I'm all ears because this is hard.
Well, and I was just going to add on. I think the big takeaway there with the unwired, the deskless employees, and we have that same challenge with our healthcare clients. Actually, a lot of people don't think that maybe healthcare hospital employees as non-wired, that they're not sitting at a desk. And so we do rely on the print mail, and we do rely on communicating in a variety of ways to be able to get that message out to those individuals. Any other questions? And you can either type it in the chat, or I think you can unmute yourself, right, Gary? Can people unmute themselves?
Apparently, Gary.
Yeah, I was gonna say, yeah, Gary typed correct. And we're always happy to connect on email or phone if anybody has other questions or ideas, thoughts. Like we think this is an extremely important topic and something that needs to be continually talked about in the workforce. If not, if there's no other questions, we can turn it back over to Sydney, and Gary, you can spotlight her to wrap us up.
Wonderful. Thank you so much, Guy and Melissa. I think I can speak for everybody when I say that was incredibly informative and extremely helpful. I downloaded the guide. Absolutely going to be leveraging those in some capacity. I think I have one more question for you, if you don't mind. Because it's Mental Health Awareness Month, what would you suggest is an entry level first step for an organization to really start to get the ball moving for conversations like this? Not really ready for a full blown campaign just yet, but to really get folks to start thinking about the importance of this.
Good question. So with the HR communications that are already going out, if any of the messaging related to mental health can be emphasized and included in messaging that's already going to employees, whether that be regular updates, newsletters, emails that go out this fall when you're sending out open enrollment materials, take advantages of those opportunities when employees may be paying attention to benefits information generally, to start to have that conversation about mental health specific to the resources and support that is available to them on the mental health side. So I would say utilize your tools that are already in place and start to expand the conversation there.
Yeah, and I would say I would completely echo what Melissa said and just say, start talking about it, but start talking about it in a way of giving examples of how you might, how an employee might use if they have an EAP, right? Giving those examples, just because I think so often the HR communications has always just been like, well, we have an EAP if you need mental health, and that was it. Well, I don't think I'm, diagnosable, but maybe I have some stress. So maybe it's more use the EAP for stress, or, in just giving those examples, I think really does help employees kind of begin to relate to what it is that the EAP could be used for without having to create a whole campaign, right? But just kind of, making that message a little more clear.
Absolutely. I agree. And I think the lifting up the mental health or mental well-being, as you mentioned, in the forefront of those benefits communications is a really great way and a quote unquote easy lift to start to get this communication out there. So B said, thank you for this webinar. It's a huge issue that cuts across all genders, ages, and layers of the company and deserves more attention. And I think we couldn't agree more.